Welcome to the Java Cafe, Java fam. Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everyone. Good morning. Good morning. Good morning. It is Tuesday, December 7th. Let me double check. It's Tuesday, December 7th, 2021, and you are listening to another episode of Your Healthy Java, sponsored by the Massachusetts General Hospital Office of Equity and Community Health. Shout out to all the team and staff there. Listen, we're going to jump right in this morning. I refer to him as my co-host, but our medical director / co-host, Dr. Claude Alabre, is going to come in. And before we bring in our guests, one of the benefits of this partnership with Mass General Hospital is we're in a world pandemic. And as you all know, there is another variant that is currently in the United States, and we just found out that there is a case, at least in Massachusetts. And so Dr. Alabre is going to give us a brief update. There's not a whole, as our guest that's coming on tomorrow mentioned in the city's press conference yesterday, there's still a lot of research being done around efficacy of the vaccination and also transmittability. I believe I said that right. And so this is why we have the experts. I'm going to bring in Dr. Claude Alabre, who is our medical director of this partnership here. Dr. Alabre, good morning.
Good morning. Good morning. How are you?
I'm doing well, sir. How are you? How are you?
I'm doing well. Thank you.
That is good.
Good morning, everyone.
I'm going to ask you, as I often do with my guests, because you guys are there taking care of patients. Give me one word, sir, to let us know how you're doing in the mental health space, and then we'll turn it over to you to give us a brief update about Omicron.
Sure. I think I'm doing well. Still hanging in there.
Okay. That's a few words, and we'll get one out of them soon. But Dr. Alabre, in all seriousness, one of the benefits of this partnership is that we can pivot. We have our topic today, but given what's going on with COVID-19 and this new variant, with the limited information that is available to the public health community, what updates are you able to give us this morning with the limited information that's available?
Yeah, no, that's the key part is limited because there's very little that's known. It's obviously being studied, being looked at, but it's here. We know it exists. The Omicron was the latest variant to be listed as a variant of concern. Remember, we talked about these different classifications before. And so now we're looking at what that all means. There are some data from South Africa primarily about sort of how it makes people ill. Most of the reports are saying sort of mild symptom, but very similar to the Delta variant. There was one update yesterday from South Africa from the health minister saying that it seems that people who have not been vaccinated, who had prior COVID infections, are getting it more. So basically saying that the immunity from prior infections is not as great as it is from the vaccine itself.
Can you please slowly, and as the community says, in the back, because there is this, I talked to someone that tested positive a few weeks ago, and their response to me was, this is my vaccination.
Right.
And so can you please just reiterate that? Because while we have people's attention, I think it's imperative that we...
Right, no, that's always been a big sort of area of study, trying to figure out how long does the immunity from prior infections lasts.
Yes.
And we don't have definitive answers on that in terms of months or weeks. All we know right now is that the vaccine itself seems to provide better protection, or protection longer than the infection itself. And then from, again, the health minister from South Africa yesterday saying that it looks like the protection from prior infections is not as great for the Omicron variant that is out there. Again, it's preliminary. We're still learning. We have to stress that. And so we do know, as you mentioned, that it has been detected in Massachusetts, and it is expected to sort of take over Delta. Delta is still the most common variant. 99% plus of the cases we have are from the Delta. But a lot of experts are saying that this likely will turn out to be Omicron in a few weeks or months. We don't know. But really the lesson all about this is, if you haven't gotten your vaccine, this is the time to do it. And we do know that everyone is encouraging everyone to get the booster if you are eligible, which is pretty much everyone now anyways. And so over 18, I believe, should go ahead and get the booster. It seems, according to the CDC, that the protection from the vaccine will still work to some degree, and we're hoping that it still will reduce the risk of hospitalization, death, and serious illness. And so you may have mild symptoms, like we were having breakthroughs with the Delta. It's expected that we'll have some breakthrough with Omicron as well, but the severity will be less. And so this is not the time to wait. And that's really all I want to say at this point, is to get yourself your vaccine.
Dr. Alabre, thank you so much. I'm getting ready to bring in our guest, and this is sort of an impromptu sort of question I'll pose to them. And we'll go back to this in a few minutes, but we understand that consideration for a lot of people of the vaccination, time off if they get sick, is really, and we move in the space of equity. And so I want to maybe end and just talk about the mental health impact of what you just mentioned. But I have the privilege and opportunity this morning to introduce, we talk about mental health often in the Java Cafe, but I'm not a clinician. And we do have instructor level doctors and professors that come in, but these two wonderful queens that I'm getting ready to introduce they move in this space. This is their wheelhouse, their practice. They see patients, provide some level of therapy and counsel. And so I am honored to have both of them in the room. And as we are moving in equity, it is definitely imperative that we properly pronounce people's names. And so I'm going to do my best to make sure I do it right. In Nkechi, we have Dr. Nkechi Conteh and then Dr. Aderonke Pederson.
Perfect.
I got it right. I'm so happy. But I will go in the order of appearance on the screen. And Dr. Conteh, if you could introduce yourself and tell us one word that you would describe your current mental health status today. Good morning.
Good morning. Hi, everyone. I am so excited to be here. I am Nkechi Conteh. I am a community psychiatrist at Mass General Hospital. I'm also a reproductive psychiatrist, so I work with women throughout their reproductive cycle who have mental health issues. And I'm also the Associate Program Director for Diversity and Inclusion at the MGH McLean Psychiatry Residency Program. One word to describe myself would be, I am feeling hopeful.
Hopeful. Awesome. Awesome. And Dr. Pederson, if you could introduce yourself and give us one word as well.
My name is Aderonke Pederson. I am a psychiatrist as well at MGH. I also see patients at the Dimmock Center. I conduct research in mental illness stigma in the Black community, looking at ways to understand the content and characteristics of stigma in the Black community as a means to find ways to reduce that stigma and improve mental health outcomes for Black people in the US, and I've done some research globally as well. So I'm so excited to be here, and I think the word that I would use, and I wanted to be more positive, but I would say tired.
And thank you. This is an authentic space, and so thank you for your transparency and being real. I will, and as I said before, we check in like this because you all are providing the care. You all take on a lot of the issues of the patients that you not take it on personally. I'm sure you have clinical supervision and, debrief, but you're human. And so I think it's important that we be real. So we have hopeful and tired, and that is very real for those of you that are in this space. Dr. Alabre, in real time, I would like to offer you, if you wanted the opportunity to fall out in the background and come back, it is definitely up to you, sir, as we jump in this conversation. Or if you want to stay in, it's up to you. I tell him he's my co-host, but Dr. Alabre also, like these two, see patients and stuff as well. So if we can offer you a few extra minutes, the choice is yours, sir. Let me know. And we sort of did this in real time, but
I'll go with one word as well: cautious.
Cautious. Okay. Awesome. So we're going to keep Dr. Alabre in the room and sort of jump right in. And Dr. Alabre and others and I have talked about this. And Dr. Pederson, you kind of took my next point. There is unfortunately a stigma to doing what it is that we need to do to maintain our mental wellness. And then when there are issues of mental illness, there's a stigma generally. Now let's put that through the lens of Black and brown people in a system that has not historically always been so accommodating towards us. Let's frame it like that. And so with that, I will go in this order with Dr. Pederson first is what are some of I entry level believe I know some things in this space, but you all are the experts. What are some common issues that come up this time of year as we're going into the holidays?
Yeah, I think that's a great question because I think things can be seasonal. So when we're going into the holidays, we're also talking about the weather changes in a lot of places in the United States, right? It gets darker earlier, it's cold, and people are more likely to be isolated indoors. And then you add on top of that COVID-19, the Omicron variant that's out now, and to Dr. Alabre's point, the caution, that starts to well up again. So certainly things like depression, anxiety about the environmental situation, about should our party be as big as we planned for it to be? And again, those questions that you thought you would be past. I mean, the promise last year for a lot of people was, don't have Christmas, don't have a big Christmas this year with everybody, keep it small. And then we're back here again, and numbers are going up in different places. So I think it's really, important that as, health professionals and mental health professionals, we're checking in with our patients. We're checking in, with people saying, how are you doing? So I think depression, anxiety, seasonal affective disorder, and not a, disease or a disorder, but isolation and feeling kind of like you're withdrawing from society again, and you're having to make these decisions for your health, but then it could impact your mental health, in a significant way as well.
Thank you so much for that. And Dr. Conteh, I want to say it right, Dr. Conteh. Thank you. What is your experience in the community health, in the community behavioral health arena? Is it the same? Is there more? Are there more things you're seeing? Are things different? As Dr. Pederson said during the holidays. What are your observations?
So I agree with Dr. Pederson. This year, particularly, something that has really affected the Black and brown community is the loss of church and religious involvement. This is something that has really impacted the Black and brown communities. The ability to go to church during Christmas, the ability to hang out with church folk. A lot of us get our mental health and wellness restored at churches. And with COVID-19, we have lost that structure. We have lost that safe space. So that's an additional layer that has affected our community specifically.
The other piece about, and thank you for raising the faith community in some other arenas. I just wanted to name, in case any are watching, we also have to consider the fact that the pastors, the laymen are impacted, but the pastors who have been able to eulogize, and considering the mental health impact of those that have not been able. I've talked to some pastors and they have really shared that it is very interesting as far as what they are able to do and not to do. And we're kind of going into this, but other things, Dr. Pederson, in a world pandemic, you've named some things around inequity. What are, with the issues, what are some other things that contribute to our behavioral health wellness, and also, in the worst case scenario, addressing mental illness?
So things that contribute in terms of our wellness, the thing about mental health is that it is all encompassing. Um, we, for a long time as a society, have looked at it as, here's your mental health over here, and here's your physical health over there. And make sure you do everything you can for your physical health, but there's always this sort of cloud over mental health, and this idea that am I weak if I need help with my mental health and well-being? And that's part of that stigma. So I think when we're talking about all the things that contribute to our mental health, it's all encompassing. Your physical well-being contributes to your mental health. Your relationships, we call them psychosocial factors. So things that have to do with psychology and the social aspects of living. So who's around you, the family dynamic that you're in, who's missing at the table this year. So all of these things, combined, can impact our mental health and well-being. And so when we're doing a check-in, it's important to think, through not just, how am I feeling emotionally, but what are all the other environmental things going on around me, and being honest with ourselves about what those things are.
Thank you, Dr. Pederson. With all of that being considered, and Dr. Alabre, I'm going to check in with you to ask about the correlation between, if someone comes in the office. Dr. Pederson referred to the fact that do the doctors sort of check in, with the patients? And so we'll talk about that in a second. Dr. Conteh, have you noticed if there are more requests for therapy? Are there more requests, or not more requests, but unfortunately, have you noticed if there are more hospitalizations? I know the residency program sort of, does some inpatient and outpatient as well. What are your observations in the world pandemic during the holidays as far as increase or decrease, request of services?
I will say that we are completely booked. I really wish we could multiply the number of psychiatrists, therapists, social workers, psychologists we had in America and in the world, because the requests for mental health services has increased rapidly. And this is despite the fact that telemedicine has increased access in some way. We still are not enough. We still don't have enough providers providing care or able to provide care. Our clinics are booked. People are coming in. People coming into the hospital has some stigma associated with it. So most people just want to talk to someone, but still we're not enough. So definitely there has been an increase in the mental health services request.
Thank you so much for that. And then let's just name again, there are some Black and brown potential patients that prefer a Black and brown, therapist, with the presumption that there is a familiarity with life experience and things like that. Dr. Alabre, and we maybe not talked about this in the behavioral health space, but you did in one of our first sessions, you did talk about what Dr. Conteh just named as far as people not wanting to go into the hospital. But those that do come, have you found during the holidays that people may reach out to you more, or knowing your patients, being able to ascertain they're not just their usual selves today? What have you observed in reference to request to speak to a therapist? Yeah, we'll go with that.
So there's definitely an increase, and it's a bit complex because there's so many factors. And as Dr. Pederson mentioned, with the pandemic, it's certainly sort of multiplied this whole situation by 1,000. And so it's kind of good and bad. In one sense, I know Dr. Pederson mentioned she does a lot of work in stigma. So in one way, it is nice to see that people are comfortable enough asking for help and reaching out and wanting to get mental health care. It's unfortunate that we happen to be in a situation, as Dr. Nkechi mentioned, that we just don't have the capacity. So now we're sort of in a sort of good and bad situation where the need is there, the willingness to do it is there, but we don't have the capacity. And so it's really putting us in a very, very sort of bad situation where a lot of non-psychology, psychiatry trained physicians, providers, health nurse practitioners are sort of stepping up a little bit and providing that kind of a care. And we are hoping that, as the need increases, there will also be an increase in supply in providers. Telehealth, as Dr. Aderonke mentioned, has helped a bit, that people are able to do this from home, not coming into the hospital if they are concerned about it. And for the most part, psychiatry is fairly virtual at this point. So not a whole lot of psychiatrists and therapists are providing care in person. So that's helped some. But we are also leaving people behind because not everyone has access to the internet, to computers and capabilities, the tech that we need to be able to provide care that way, or are not familiar with the technology to be able to use it. And some people really just simply prefer to be in person. So it's a lot of changes, and it's a very complex situation.
Dr. Alabre, thank you. And I want to take this opportunity to give both of our psychiatrists, our clinicians, an opportunity. If you are a young person or in college and you're considering this field, I'm going to put one of them on the spot. Which one? Who do I encourage to, or would you all encourage, what would you say to aspiring clinicians that right now in the world pandemic, they're like, I don't know if I want to, go into therapy. There's obviously a need for more psychiatrists and clinicians in general, but specifically for Black and Brown. And so, Dr. Conteh, I'm going to put you on the spot and ask you to do a 30-second elevator speech to those that are considering going into this field, because I'm sure some are watching now that are interested, and I think it's an opportunity just to let them know that there is a need.
So I'm going to be very real and say, do it for your mama. Do it for your family members. The need for psychiatrists and mental health specialists in the Black and Brown community is so huge. We don't have enough numbers. We have people, and we need people who understand what it means to be Black in America, who understand what it means to be brown in America, who understand what it means to grow up with discrimination and systemic racism following you everywhere you go. I would say connect to science programs. We have STEM groups. We have local community organizations that help connect students, high school students, medical school students to psychiatric providers. We have mentorship groups. We have national organizations that mentor high school students, that mentor college students. There's a lot of opportunity out there. I would encourage you to access it. I will encourage you to reach out, because people like me and people ahead of me who've been there are willing to help and are willing to bring others into the field.
Dr. Pederson, I see you nodding your head. Would you like to add to? I knew that when I heard something from you all, I knew there was an opportunity there. Dr. Pederson, would you like to add to that?
Yeah, absolutely. So 5% of physicians in this country are Black, and there is an ongoing deficit. Between 1940 and I believe it was about 2018, they did a study looking at if there was a difference in the percentage of Black men in medicine as physicians. And they found that there was not a significant difference in terms of the percent when you think about the population of Black men in medicine. So there's certainly a deficit of Black physicians. And when you look at fields like psychiatry, like mental health, because of the combination of things like medical mistrust and stigma related to mental illness, and the fact that historically, even the American Psychiatric Association, the American Psychology Association, they've come out with statements talking about the historical issues, the historical problems related to how Black people have been treated in these areas. And so we need people with lived experience. We need people like Dr. Conteh is talking about, who understand what it means to actually live out and see their families live out these issues. And, without mental health, there is no health. That's what the World Health Organization said at some point. And so how can we progress, as a people group in terms of the Black community when we're talking about racial categories, if we don't have people on the ground who actually understand? Because it's not something you can just teach in a lecture in a classroom. It's something that, lived experience is the PhD of what it means to be Black in America.
So I think this is Dr. Alabre. I think this is the first time one of my guests have stumped me a little bit, because this is so real. And so again, this is an organic space in real time. What you all just named is there was some level of vicarious trauma in there. And though we didn't sort of, plan to talk about this, I perceive you two as experts with what's going on in the world pandemic, with what's going on in what we see in the media around the inequity in the law and in the justice system. Can you, Dr. Conteh, speak a little bit to the impact? We're talking about the holidays, but around the holidays, we have to consider vicarious trauma. In this particular city, the last couple of years, there have been issues of violence. All of you have named people missing at the table at Thanksgiving. For some, this is the first year from violence to losing during the pandemic, just for other reasons. And so if you're human, you don't hear about these things and not feel to them. And Dr. Pederson, I want to go back to your statement in a few minutes after we hear from Dr. Alabre's thoughts on this about life experience being the PhD. I need you to unpack that a little bit, because that is imperative, I think, for all providers, but especially for providers that don't have that lived experience sorry, y'all done took me to a whole different place. Dr. Conteh, can you speak a little bit to vicarious trauma? And Dr. Alabre, I'll ask you for your observations as well when your patients come in, because there is a physical impact of unaddressed trauma. My old pastor used to teach unaddressed issues have babies. Go ahead, Dr. Conteh. Y'all, okay, go ahead.
So there's a book called The Body Keeps the Score that talks about the impact of trauma on the body. And as you know, even with child psychiatrists and child psychologists, neurologists, things that happen to you when you're younger, they stay with you. They stick when your time multiply, depending on the number of traumas you experience. Your resilience is impacted by that. And someone once said that saying someone is very resilient is like saying someone is just one stop away from a complete breakdown. We don't talk about resilience anymore, because we feel that term is a little, it's like giving people the permission to continue hurting you. So in our Black and brown communities, so many of us have experienced trauma growing up that has followed us through and has sort of made us hypervigilant and cautious. And this is where Dr. Alabre talking about cautious. When Dr. Pederson talks about medical mistrust, what you've seen growing up, what you experienced in your household, what you've seen your family members go through, all of that impacts you. And speaking to someone who doesn't really understand is difficult, because how do you start?
Thank you so much for that. There, we had a little tech glitch, and there was something that you said, and I want to that remove the thought that I had. Dr. Pederson, it will come back to me. What are your thoughts about the vicarious trauma? Actually, I'm sorry, Dr. Alabre, what is the physical impact? And then I want to go back to Dr. Pederson about the PhD comment. Dr. Alabre, based on what Dr. Conteh said, what is the correlation between unaddressed mental health and the body? How does it demonstrate itself?
It's everywhere. I mean, there is a huge field now in sort of the mind-body connection, mind-body understanding. And we have really good science to tell us that it's all interconnected. And what you see, how you act, how your body behaves. And we've talked about stress before in this on the show, and how it affects your sleep, your mood, your memory, your concentration. And I mean, it goes beyond these few things that I just mentioned. We have people literally coming in with physical symptoms, and when you really take a good step back, if you're lucky to have the time to do so, you realize it's all about the mind. It's all about the stress and anxiety and depression. It gets even trickier, because convincing someone that that's what it is, and especially in populations where there's already a stigma around mental health, when the person basically doesn't want to feel that it's the mind, they'd rather it be the body, because saying it's the mind, it takes a whole new level. It's the connotation to that is so dire, so significant in some people that they will not accept it. So it makes it, again, more difficult to deal with. But we know that the body cannot function without the mind. Mental health is health care, and as Dr. Pederson mentioned, and this is real. This is what happens.
Thank you so much for that. And so we know that there are, this is for the community, but we know some of your colleagues and providers actually tap in. And so Dr. Pederson, I want to go to providers, and then we will sort of just do what they call a lightning round and just, recap some of the things that we talked about. But you said that life experience is the PhD. Can you clarify that statement? I want to capture it properly, but give us some context around that, because as both of your colleagues have said, people are getting to a point to where they want services. How horrible is it that they get to that point, and every medical expert that I've had from on various topics have named the systemic racism that is embedded somewhat in the a lot of industries, but in the medical industry. So can you sort of speak to, if you don't have the PhD of life experience, how can you better exemplify equity to Black and brown patients if you are not one?
That's a great question. And as you all know, we could do a whole segment on any one of these topics that are coming up. And I obviously respect our education system and, what it means to get an MD and a PhD, and in no way, diminish any of those accomplishments in talking about the importance and the significance of life experience. So I'm going to talk very briefly about two things: cultural competency and cultural humility. Cultural competency is about mastery of how we interact and relate across cultures within medicine, and how we're sensitive and attuned to all of the different racial, ethnic, diverse cultures that we interact with in terms of the patient to provider, patient to physician interaction. Now, cultural humility is somewhat newer. Cultural humility is about self-critique, self-reflection, self-evaluation as a provider, as a physician, saying, when this person walks into my room, walks into my office, am I, in charge of every aspect of who they are? Am I bringing a paternalistic approach to this interaction? Am I taking a step back and saying, yes, I'm bringing science into, I'm bringing my expertise, I'm bringing the science into this interaction, but they're bringing something that I need to sit and listen to and understand, the way they do things, the way they approach their healthcare in a non-judgmental fashion, because that allows them to open up more. You can't treat something that a patient doesn't tell you is going on. They first have to tell you. And I think part of them telling you is coming from a place of humility. So I love this idea of cultural humility that's gaining traction in the literature right now.
Thank you so much. Dr. Conteh, your thoughts on cultural humility. This is my first time hearing that, and so I am definitely intrigued. For those of you that are listening, and we have 57 comments, and so I'm going to go through them, Dr. Conteh, while you're talking, to make sure we have some, we can answer some questions from the community. And Dr. Alabre, I'll let you know in the beginning I'm scrolling up, and there are a couple about the variant, and so I'll try to decipher those.
So I love the term cultural humility, because everyone should be culturally humble. Everyone's experiences might be similar, but people still have their own individual experiences. So everyone could learn a bit of cultural humility. And research has shown that providers who are discordant with their patients in terms of patient-provider concordance, you're a different ethnicity or a different race, tend to spend less time explaining health issue, explaining medication, explaining treatments to patients who don't look like them. And these patients leave feeling unheard, leave with questions. So that's where cultural humility comes in. There are very basic things you need to do. Like Dr. Pederson said, reflect. Am I treating this person as I would like myself to be treated? Am I treating this person as I would like my family member to be treated? What am I leaving out? Am I leaving room for questions? Am I assuming rather than asking for permission? And there are ways to get more understanding of what it means to be culturally humble. There's a lot of textbooks, there's a lot of in the literature, there's a lot of education you can get in being culturally humble. It talks about bringing a childlike curiosity to the table. I really just want to understand rather than I'm telling you what to do, I'm telling you what is good for you. Another way to look at this is calling it a patient-centered approach, putting the needs of your patients first. What does this patient need? It may not align with what you think they need, but the patient deserves to be heard.
Dr. Conteh, I'm sitting here shaking my head because there is so much here. Dr. Alabre, you're shaking your head. Any thoughts on cultural humility? Because it's not, that's across the board from, let's just say, from the time you walk in the hospital. I know the MGH does a wonderful job at having greeters and patient assistants there. From that experience until you get to the check-in desk, until we're talking about mental health during the holidays, but it's all inclusive. And so, Dr. Alabre, your thoughts there. And then I do have one question about the variant. And then someone else posed a question for you all about how do you all unpack in self-care. And so I'll prepare both of you for that. But Dr. Alabre, your thoughts on cultural humility?
I mean, most of it has been said. I think the one thing I wanted to mention is the problem is I know we're talking to patients now, mostly to the layperson, but I think this matters more for providers and healthcare providers at all levels. One of the issues is that we are sort of trained to think like the experts, and so it is a bit problematic when you try to tell a doctor, any kind of expert in their fields, that they need to be more humble, because it kind of almost goes counter to what they have been taught and the position they feel that they're in when they're seeing that patient, that they're the ones to know. And so there's a lot of work to be done in that area to sort of bring that humility at the highest level and make it work for the patients.
I appreciate that, and we can surmise it. I think there, I don't know who the artist is, but be humble. I don't know who. I think there's a track out or a couple of years ago. I'm telling my age. Dr. Alabre, we're going to start with you. Everyone, if you have questions, I know some of you may ask some questions about the virus and the variant. We are focusing on mental health today, but while we have Dr. Alabre here, and I would ask also my guests to be prepared to talk about how you self-care. And then if we could specifically speak to, you know, the mental health impact of, there is a mental health impact of considering the vaccination. I want to be very honest about that because there's so many factors that play into it. And I'm sure you all are going to speak to it. But Dr. Alabre, there is a question from Dina Marshall in Boston. If you had the vaccine, had COVID, and had the antibody infusion, do you still need to get a booster? Now, I'm not a physician, but based on what I heard, I'm going to say the answer is yes. But Dr. Alabre, am I wrong?
The answer is yes, yes.
Okay.
With just one caveat. So if you have had the antibody infusion, the recommendation is to wait 90 days before you get a vaccine. Outside of that, as you know, we've been mentioning on the show, having had COVID itself does provide some level of protection. The problem is we don't know how long that lasts. We haven't been able to measure it and tell you specifically that it's going to be at 1 month or 2 months or 6 months that you would need the vaccine. So we're not relying on sort of natural immunity in this case. We're asking everyone to get the vaccine. The second part of that is that when you sorry, I'm losing my train of thought a little bit there. So
it happens, Dr. Alabre.
What's that?
I said it happens. It happens.
I know. So yes. So regardless of whether you've had COVID itself, the recommendation is to get the vaccine, as far as we know, and to get the booster if you have had it more than 6 months. The second shot, if you've had the Moderna or Pfizer, and if you've had Johnson & Johnson, booster 2 months later. And so that is the only thing we know right now that is supposed to protect you and provide immunity.
One clarifying question on that piece there. You had mentioned that you should wait 90 days if you've had the antibody infusion. Mm-hmm. Is that, from what you know, is that also applicable to the booster? I want to be,
yes.
It is applicable to the booster. So
yes.
90-day wait if you've had the infusion.
Yes.
Okay. Excuse me for 1 second. The other thing that we usually say in the beginning is that the disclaimer here is that none of these physicians have examined you. We are answering general information. They cannot. That's one of the reasons why the APA couldn't make a determination about he who used to occupy the White House, because they couldn't examine him. I just throw that in there. But I want to ask our guests to really speak to, because this is a platform that is about mental wellness and self-care. And so, and Dr. Alabre, I'm going to throw it on you too. But I'll start with Dr. Pederson. The question was asked by Rena Francis, who curates a space, intentional self-care. How do you all have the opportunity to unpack? I'm familiar, there's supposed to be clinical supervision, but you know, in a pandemic and things just get very interesting. What do you all do to ensure that you are taking care of yourselves? Dr. Pederson, I'll start with you.
You know, I see therapy as a resource that's out there, and I can't understand why I wouldn't make use of that resource. It's sort of like having, you know, something when you have access to it. Obviously, there are limitations around access. So as a physician myself, I, you know, over the years would have a therapist, you know, who I was seeing once a week. And it was a very, you know, growth filling time and space to not be the caregiver, to be cared for, and to unpack the things that I'm going through. I think in our field, and I'm sure Dr. Conteh can speak to this too, part of our training is the fact that you need to care for yourself too, that you can't go out there saying that, you know, you want your patients to lean on you and you want to support your patients if you haven't unpacked, to use the word that Rena used, unpacked your own stuff. And so it's so important, you know, for us to get that kind of care. Some of us see therapists, some of us see psychiatrists, some of us see licensed clinical social workers. It's not even a matter of this person has to have a higher degree than you or anything like that. It's more about using that space, you know, in a way where you can be at the center working through things yourself.
Thank you. Dr. Conteh, your answer to that. How do you care for yourself?
So I think this is related to your question about vicarious trauma, where in which that people who, or providers who care for people who have experienced trauma, start to feel some sort of change in themselves too, related to the trauma, right? And this is what I'll say in addition to what Dr. Pederson said. Listen to your body, listen to yourself, listen to how you feel. If you're more irritable, if you're more anxious, if you're noticing you're not sleeping right, listen to your body. So that's one thing that I had to do. I thought it had to, in addition to what Dr. Pederson said, listening to my own self, listening to how I feel on a day-to-day basis. Am I sleeping well? Am I waking up with a headache? Am I eating right? Am I exercising? Am I doing the things that I know I should do to keep myself healthy? Or am I going to bed thinking about the patients I saw? So these are some of the things that I had to put in my own life to make sure I maintain my own mental well-being. The other thing I would add is peer support. Dr. Pederson is a wonderful peer support for me. I just have to say it there. Having people around you who you can rely on, who you can talk to, who you can send a text like, I'm having a hard day. Can you talk me out of it, or can you support me through this?
That is definitely something that's needed. And similar to the session we had with, and I can't, Dr. Alabre, please remind me of her name, that did the piece about Thanksgiving.
Dr. Stanford.
Dr. Stanford. So there's some things that you all are saying here, and I'm in the background taking notes like, oh, Jimmy, you need to maybe check in with yourself about that.
Actually, I have a question for both Dr. Conteh and Pederson. So we know access is an issue, and we've talked about the importance of actually caring for yourself and how mental health is important. Do you both have any tips on what someone who's currently, you know, a few days away from Christmas and New Year's, struggling or reaching out already and can't find that care that they need, what can they do?
Who will go first?
We'll start with Conteh.
Okay.
Sure. So I love the idea of community engagement. And I would say there are many online resources. There are many crisis line calls. There are many phone calls and emergency room services that provide care to people. But as we're talking, it may be hard, as this is what we're discussing, it may be hard to actually reach out and call someone or pick up the phone or go to the emergency room. What I would say is, first of all, engage with a community leader. There might be a social worker or a counselor in your school. There might be someone in your college. There might be someone in your faith-based community that you can talk to. From our part as providers and as health systems, we are helping communities of color build health teams. We're helping them build medical teams so that to provide this gap, to address this gap in services, we're working with community-based health workers and community-based leaders to provide the services. One service that is available in Boston is the Best Service. This is a mobile service that will go to your home. If you call them and say you need help, they'll go to your home and give you individualized treatment and connect you to resources that you need. They may also bring you to the hospital if you need to. So that's a system that's available right here in Boston.
Thank you so much. I'm going to be in the background getting some information to put up here on screen about the Best team and also the Samaritans as well. Dr. Pederson, I told you, Dr. Alabre, you co-hosting. Go ahead, sir.
Absolutely. You know, I'm going to put a plug in for myself because I'm a transplant from the Midwest. And there is a new partnership between MGH and DMIC that is allowing me to be at DMIC seeing patients, and my schedule is not full. So if you happen to be in the area and that might be, you know, one of your providers or health systems, tell your friends, tell your family members, I'm there for this very reason because of all these issues we're talking about and issues with access. And I'm grateful, you know, to MGH, the Center for Diversity and Inclusion, and the partnership with DMIC that I can be there. The other thing, you know, to keep in mind, just like Dr. Conteh talked about, community organizations. A lot of times, some of the academic institutions are partnered with community organizations locally. And it doesn't have to be, you know, your first contact doesn't have to be with a psychiatrist. Your first contact doesn't have to be with a physician who's a psychiatrist. It could be, you know, with a social worker. My therapist, you know, has been a social worker, and I get great care. So I think in terms of access, that first point of contact is really just getting started. And a lot of times, even if you don't know how to make that connection to a psychiatrist, that social worker, that case manager, I get a lot of patients through case managers who are able then to make that connection to me while I'm at DMIC.
And I have a follow-up question, actually. I know you both are obviously trained physicians, psychiatrists, and we tend to talk a lot about medicine and therapy and seeing professionals, but are you comfortable speaking to the evidence behind the non-therapy based sort of mental care, exercise, good sleep, in these sort of non-medicine or non-therapy methods?
I can start. Oh, sorry. I can start. So just like we've been talking about in terms of mental health being connected to everything, one of the things, you know, that we see, and there's a lot of, you know, studies showing things like this, that when one has psychological stress or distress, depression, it can increase your risk for things like damage to your blood vessels. So it's called like endothelial recovery, just the technical term, but it can result in things like damage to your blood vessels. So things that involve improving your overall well-being, like good sleep, like which is part of rejuvenating and recovery, because sleep and rest is not really optional for our bodies. Our bodies are designed to do those things because it has to take the time to recover. It has to take the time to regenerate. Other things that, you know, kind of show that interconnectedness between mental health and some of those things, Dr. Alabre, you mentioned, like sleep and exercise, healthy eating, is related to things like your immune system. So right now we're talking about a virus. So how do we bring all that together? Well, you know, your mental health can impact your immune system, the level of stress, the level of the cortisol going through your body, and all of those things can diminish your immune response. So as we talk about all these things, it's really a unified conversation about your mental and physical health being one in the same in a lot of ways, and approaching things like, again, healthy eating, you know, sleeping, at least depends obviously on your body type, but sleeping in a way that you're rested and you feel rested, you know, the next day. And certainly exercise and endorphins and all of those things that then can reduce your risk of depression and anxiety and some of these mental health disorders we're talking about.
And I'll just add to that. Exercise and complementary activities like yoga and acupuncture, there's a whole field of science that is investigating the impact of exercise and yoga on the body. And actually, that's some of the recommended treatments we have here at Mass General. Exercise is known to release endorphins that creates a positive feeling in your body. So you can imagine if you're exercising frequently, you keep on having this release of endorphins that translates into feeling well, feeling positive about yourself, feeling your self-esteem is impacted. Yoga is something that we recommend to women who are pregnant to maintain their women's mental health. These are things that people can do that are not directly related to medical care or to medicine, but these are ways to improve your health and to improve your self-esteem. Other things like mindfulness, meditation. I tell my patients, go to a spa, fix a spa day, just self-care, indulge yourself and take care of yourselves. These things do help with maintaining good mood during the holidays and even afterwards.
Dr. Alabre, is that it, sir? Do you have any
No, we should get the viewers' questions. This is they're waiting.
We do have a couple, not so much questions, but we have, okay, so I did just see one question. Belinda from Boston is asking, is there such a thing as trauma therapists? How do you find someone to address past trauma? I would presume, is the name therapist applied to doctors or social workers with a master's degree? Good question, because there is, licensed clinical social worker, there's licensed social worker, there's the licensed mental health. So there, can we do just a quick breakdown of that? Either one of you.
I'm happy to go again. So in terms of the different kinds of, I'll start with just what a mental health provider is or a mental health professional is. That word or that phrase or term is very all-encompassing. But in terms of what a therapist is, usually there's some training related to therapy, and that does vary across the spectrum. So you have people who are social workers who then become, as part of their licensing process, and there's a licensing process across the board, become licensed clinical social workers. And that clinical piece and the therapy training that they have is part of why they then make their services available in the community as therapists. We also have psychologists. So psychologists could have a PsyD, so a doctor of psychology, and a psychologist could also have a PhD, which sometimes may be more academic. But then there's also, again, this licensing piece where you could be licensed in a clinical sense, and you do training essentially like seeing patients, getting supervision in a therapy space. So what a therapist is a lot of times, most commonly, is a licensed clinical social worker, a psychologist who's seen you either has a PsyD or a PhD, or a psychiatrist. Psychiatrists also work as therapists and also are trained as therapists. And in terms of a psychiatrist, that also has a wide spectrum, of training, things like psychoanalysis, which is like very hardcore, therapy that we offer. And then the last piece in terms of the trauma therapist, yes, across all of those different fields or areas that I mentioned, people could then subspecialize and say, I mostly focus on things like trauma, or I focus on traumatic brain injury, which is different, right? Than, trauma related to, say, physical or sexual assault, things like that, or even an accident or something that happened. So when you call, to make an appointment, just ask that question. Is this person specialized in trauma care? Does this person see patients who have gone through trauma? And a lot of times they'll be able to point you. So when you call a place like MGH, we do have people who specialize in PTSD and in trauma across the spectrum in terms of psychologists, social workers, and psychiatrists.
Thank you, Dr. Conteh. Anything to add to that as we get ready to wrap up?
Yes, I would say from the patient's perspective that trauma is huge. And if you're looking for someone to address trauma, it might be that you need to start from the basics and just look for someone to address mental health. because digging into trauma is like diving into the deep end of the pool before you learn how to swim properly in the shallow end. So I would say just start with someone who can assess your mental health well-being, someone who can help you cope from day to day. And then when you're ready, you can take the next step of digging into your trauma. But you have to do one before you get to the other for the best outcomes, I would say.
So, Dr. Conteh and Dr. Pederson, you all, Dr. Alabre, the debrief after this one is going to be interesting. I just want to make sure we got all the questions. Linda, if I understood Dr. Conteh earlier correctly, MGH right now in behavioral health does not have any capacity. Am I correct?
No, not at all. No, we have capacity. We are taking on new patients. I am taking on new patients at MGH Revere. What I'm saying is we're not enough.
Okay.
We're not enough. There are not enough providers. So there's a Center for Anxiety and Trauma and Stress Disorders at MGH actually that's doing research and also providing care for people with trauma. So we have availability.
Okay.
We just don't have enough providers to serve everybody.
Got you. Thank you for that clarity there.
And we're always hiring new people like me who then have capacity.
And if I can add a couple of actually resources as well. I know a lot of people are using psychologytoday.com, which is a great resource. It provides a lot of opportunities to filter by choice. So you can enter your insurance coverage, you can enter what you're looking for, you can enter your zip code, you can enter if you want female providers, male providers, young, old. So it really gives you a lot of opportunities to select and filter and get. Thank you for posting that. And so you can then get a list of providers that are available and contact them directly from that website as well. And numbers are provided. You can call if you decide to. There are also lots of community resources. I know we mentioned about some community resources places. There's the Elliott Community Human Services. There's North Suffolk Mental Health, Riverside Community Care in Dedham, and the National Alliance of Mental Health, Mental Illness. All these websites are great resources, and obviously speak with your doctors. I hope by now everyone is getting a PCP if they don't already have one, every one of our listeners. They should also have resources that they can provide you to access mental care.
There are also a couple of resources that I'm putting on the screen or scrolling across the screen right now. There's the Samaritans, where if you're feeling, and we've said this in other spaces, if it's to a point to where you just feel like I'm going to be very real, at the end of your rope and you don't want to go see anyone, but you're comfortable talking. And my understanding is that you can text this number. And so there's a resource there. And scrolling below that is the best team to which Dr. Conteh referred to earlier. And so what I'd ask, Dr. Conteh got me earlier, said I gave them homework, but if you guys don't mind, any resources that you all have that you want to send me, I'll make sure that we get it on the Java with Jimmy Facebook page. And so folks can have that information. We are right at 10 o'clock, and I don't want to rush you all off, but I know you have clinics and patients and meetings and billing and notes and things to write. And so I really want to say that I appreciate both of our guests today and also my co-host, and allow them an opportunity if they would like to make any closing statements. Just period. I really enjoyed you all. Dr. Alabre, we're going to have to figure out how to have them back in some, because as Dr. Pederson said, there are a couple of things that we can unpack a little bit further. And so thank you both. I'll start with Dr. Conteh, your closing statements.
So I did make something with Santa, using Santa to help people to remember as they go through the holidays. As I said, I'm a reproductive psychiatrist, and my specialty is women in the community and globally. I would say taking the word S for self-care. Make sure during this holiday period you do some sort of self-care, be it go to a spa, make sure you have 8 hours of sleep, make sure you do something fun for yourself. Look at the A in Santa, ask for help. Don't do this by yourself. Don't plan a whole Christmas dinner by yourself. Get your kids involved, get your partner involved. Make sure that you ask for help, because you don't have to do it all on your own. The N will be for number. Set a limit on your spending. Have it in mind and be intentional about how much you want to spend. Make sure you don't spend too much money, but make sure you have a budget. Do a gift, make it a gift and put a cap on the limits people spend. The T would be for thinking and reflecting. Think about the past year and reflect about the new year. That helps you be hopeful when you think about the new year and the prospects that are available to you. The other A, I would say, would be just to appreciate. Have an atmosphere of Thanksgiving. Wake up and think of the pleasant events. I call it count your blessings. As you go in this holiday period, this will boost your mood when you think about all the blessings and appreciate what you've had and that you've been through COVID and you're still standing here. Thank you.
Dr. Conteh, you are definitely tapped into some of the concepts of Java Fam. We do something on Mondays called Black Mental Wealth, and we've been talking about the psychological impact of you trying to satisfy your children and your partner that only wanted a massage. Your children are only going to play with the box of the $500 toy you played for. And so thank you for raising that, because come January, we don't want a different stress with a line through it added to our day-to-day stress. Doctor, you all are, oh my goodness, this is awesome. Dr. Pederson, your closing statement, ma'am.
All right. I'll be pretty brief. What Dr. Conteh said, I sign off on completely. But in terms of your care and self-care, I think it's important to know too, when it becomes time to see someone, and not just like an option, but it's really time to see someone so you can practice preventative medicine and not end up, in the emergency room. And even though if that's the case, that's okay. But we do want to, kind of catch things early. When some of these issues we're talking about, the stress, the low mood, the anxiety, starts to affect your ability to function, your ability to get up in the morning, your ability to go to work, your ability to interact with people, your social life. When it starts to affect your ability to function, that's the time, when it's really time, to get help and to seek some support. So I would encourage people, to get help early and not wait till it gets to that point, but to also be aware that that's a red flag and it's time to really seek help. The second thing I'll say in closing is it's really important, that we know as Black people, as brown people, but I'm going to speak specifically to Black people right now. It's really important we know that we deserve this. We deserve these services. We deserve this support. And I think a lot of times we're sort of like so focused on the stigma. We're allowing the internalization of that stigma within ourselves, the internalization of racism within ourselves, and we're not seeking out the things that we deserve. So if these services are there, if you have access to them, a therapist, a psychiatrist, whatever it is, other communities are using it. We deserve these services as well. So tap into it, and that's you taking care of yourself and you prioritizing yourself.
Dr. Pederson, can I please apply that to the vaccination?
Yes. Yes. Yes.
It's available. It is available. I know I said in the beginning, I wanted to touch that a little bit, but we don't have time to go that deep into that. It's available. So that last part that Dr. Pederson's, can you say it again in reference?
You deserve the vaccination. You deserve the booster, because we've been put in the back of the line for 400 years. And it's time that, if we can be at the front of the bus and at the front of the line, we take it, because we're trying to get to equity. And part of getting to equity is that we're all at the table and we're not losing each other and missing people at Thanksgiving and Christmas.
Dr. Alabre. I'm just going to turn my mic down and you can.
I know, I'm at a loss for word. It's all been said. It's so well done. No, I mean, I really don't have much to add other than I think I kind of want to quickly go back to one of the things I mentioned at one of the earlier shows, is that healthcare matters. Get it where you can. And I want to add to that, mental health is overall health. And so with that, get your mental health where you can as well.
Dr. Alabre, I forgot about that. And we need to get that meme set up. I just want to put these two resources that both Dr. Pederson and Dr. Conteh sent me, postpartum.net. So you all can actually click them. They will be in the comments, not just showing on screen. Give me 1 second. And There they go. So those resources are in the comments right now. There were no last minute questions. Come on, fam. Oh, get that part. All right. Thank you all so much. A little bit over time today, but I think it was important. Listen, if there's someone in your family, if you need to go back and watch this and hear some of the messages shared, if you're a provider and you know there's some providers around you that could use this conversation, sit them down and say, hey, here, watch a episode about the mental health impact, not just of the holidays, but ensuring that there's equity in the services you provide. I'll leave that right there. Thank you all so much for coming in today. I'm going to go do a couple of announcements. We have one of your colleagues coming in tomorrow who is working with the city around ensuring that we stop the spread and get more people vaccinated. So thank you all so much for tuning in today, and I will definitely be in contact. Thank all of you. And to my co-hosts and everybody there at MGH at the Office of Equity and Doing Things, thank all of you. This session was supported by the Massachusetts General Hospital Office of Equity and Community Health. Thank you all so much for tuning in today.
Thank you.
Thank
Bye,
you.
everyone.
Bye.
This was definitely a awesome session with our wonderful guests. I'm going to make a couple of announcements in reference to one of our other guests coming on tomorrow, and that is in, and did I don't have the flyer set up in the MGH color background. Excuse me, I've been trying to hold on to clear my throat and it just hit me there. Dr. Basola, and I'm not going to butcher her last name, is coming on tomorrow. She is the new executive director appointed by Mayor Michelle Wu recently, the new executive director of the Boston Public Health Commission. She shared some information at the press conference yesterday. She's coming here tomorrow morning at 9:30. Remember, tomorrow morning at 9:30, Dr. Basola from the Health Commission is coming in here. So we will see you then. Thank you all for tuning in today. And that's it for me. Dr. Basola tomorrow. And also on Thursday, Gail Hainville from Saturday Church is coming back to update us for Thankful Thursdays about all the wonderful work that she's been doing over the last year with runaway youth, homeless youth, and those specifically who are part of the LGBTQI plus community, and especially those that identify as transgender. And so she's coming in to update us about all the blessings, and she's going to exemplify some thankfulness for the work that she's done for the past year. Thank you all for tuning in today. I really appreciate you. Share this with someone. Share this session with someone. Thank you so much. Have a great day, everybody. Peace.